Saturday, December 1st, people worldwide will observe the 30th World AIDS Day. It's a global opportunity for people to come together in the fight against HIV and show their support for people living with the disease and to commemorate those who have died. There has been a lot of progress over the past 30 years, but people are still being infected every day. As VOA's Pearson reports, we have the tools to end the epidemic, but it's far from over.
Fear, stigma, and ignorance. The World Health Organization says these are the reasons the AIDS epidemic is not over. There's no cure yet, but scientists can treat HIV, the virus that causes AIDS. With treatment, no one needs to die from AIDS. Those with HIV can live normal, healthy lives. Those on treatment can't pass it to someone else. With prevention therapy, no one needs to get infected.
We're not there yet, though, because the ability to deliver those at the scale and with the coverage needed to be able to get HIV to go away is not nearly where it should be.
Nearly 1 million people still die every year from AIDS because they don't know they have HIV. They're not being treated, or they start treatment late. One of the biggest challenges is that HIV often affects people who are on the fringes of society.
There's populations at risk for HIV infection all over the world that are underserved, and then these include injection drug users and sex workers in particular.
It also includes men who have sex with men, transgender people, prisoners, and sexual partners of these individuals. Professor Strathty says people in high-risk groups are more concerned about their immediate needs: food, shelter, and jobs.
My research in this field really shows that you need to address the whole person and their needs in order to address HIV as one of their health concerns.
That means governments have to provide the basics, including health care, without considering moral or social norms. Otherwise, countries have to bear the heavy social and economic costs of AIDS.
The biggest thing that we've learned for preventing HIV in the last decades is that there is no magic bullet. And we have to put a whole bunch of really good things together, and it has exactly the kind of impact that a magic bullet would give you.
Scientists say using these tools, educating people, and getting more people into treatment will reduce stigma. And then, when a vaccine comes along, the world will be closer to putting an end to AIDS. Carol Pearson, VOA News, Washington.